I would like to call our next presenter, Dr. Yatish Kumar Joshi, sir, from Maharashtra Institute of Dental Science and Research, India.
Good afternoon.
Good afternoon, sir.
Yeah, am I audible?
Yes, sir, you are audible.
Yeah, I will be sharing my screen.
Not yet, sir. Yeah.
Yeah, is my screen visible?
Yes, sir, your screen is visible.
Yeah, good afternoon once again. First, I would like to I would like to greet the session chairs and the organizers, Apparent and BioLeaks, for giving me this opportunity. Second, I would like to inform that actually this is a general dentistry topic, but by mistake it has been included in orthodontics, but I have been asked to present it here itself. So I will be continuing with the presentation. The topic is exploring the inclusions of conative domain competencies in existing curriculum of Dental Council of India, a cross-sectional survey.
To YouTube.
Okay.
Sorry for the inconvenience, sir.
Yeah, India is recognized as a hub of medical education with more than 1 lakh doctors graduating every year, and about 10% of international medical professionals are of Indian origin and have displayed high professional competence. Medical Council of India has always kept in pace with the global standards of medical education with timely revision of curriculum and inclusion of newer and more relevant teaching methodologies, especially in recent revisions of CBME in 2019. CBME is competency-based medical education. These revisions have a separate module for training in attitude, ethics, and communication skill competencies called ATCOM module. So, Dental Council of India last revised the undergraduate curriculum in 2017. There have been few amendments later on, but the major revision was done in 2007. And the need for revision of the same or formulating the competency-based dental curriculum is identified in many papers. To maintain the balance in teaching methodologies, the Dental Council will have to keep up the curriculum and educational methodologies in line with the competency-based medical education module, as many dental colleges are in collaboration with medical colleges. The teaching of dental undergraduate takes place at medical colleges. So, in the revised competency-based dental education curriculum, the inclusion of a supplementary ATCOM module for dental undergraduates is anticipatory. DCI and ATCOM competencies are overlapping, but teaching methodologies vary. So CBD, the transition will be a humongous task for the fraternity. The study aims to collect perception and awareness of dental interns regarding the existing curriculum and the subtle inclusions of the competencies mentioned in the ATCOM module and the DMIMS suggestions in their undergraduate training programs. 85 out of 86 interns completed a cross-sectional survey from a private dental institute in Maharashtra. The survey was preceded by an introductory session regarding the terminologies, the concept, and competency-based dental education needed to attempt the survey. The survey consisted of 7 sections. It has the details of study, declaration, withdrawal policy, consent and non-disclosure agreement, personal biodata and educational information, background knowledge and curriculum, description of terminologies and concept regarding competency-based education, level of inclusiveness and competence gained in the attitude, ethics, and communication skill, and lastly, exposure and level of competence gained in the area mentioned in the ATCOM competencies. So we will be briefly discussing the results because the study is very elaborate. The competencies and knowledge, attitude, skill. These are the competencies, gross competencies mentioned in the Dental Council of India curriculum. That is preclinical, clinical, non-clinical work, interpersonal skill, ethics and ethical practices, communication skill, practice management, and research. So we noted that most of the students perceived the preclinical work to be completely covered, whereas clinical work, ethics and ethical practice and communication skills were partially covered in the curriculum. The interpersonal skill was poorly covered and the research was poorly covered. It was noted that the practice management, administration, teamwork, and leadership skill, although was felt as covered, but most of the students said that it is not needed in the curriculum, which was irony because our end results showed that they lacked most in the area of practice management, administration, and teamwork and leadership. The next part revealed the level of competence achievable in Dental Council of India curriculum. These are specific competency statements mentioned in the Dental Council of India curriculum. So I will be mentioning only the ones which are having a good level of competence achievable and a poor level of competence achievable. The remaining are satisfactory. So practice within the scope of one's competence, refer patients for consultation and specialized treatments, access goals of values, concerns, establish rapport with and guide the patient care, able to communicate freely, orally in writing with all concerned and participating in oral health of oral health in individual through community activities. These were the competencies which had a good level of perception of achievability. And the involvement of in simple research and evaluating practice location, population dynamics, and reimbursement mechanisms showed the least level of competence achievable. So mostly the students struggle to achieve these two red color competencies. The remaining competencies were at a level of satisfactory level. That is, they were having a satisfactory achievement of supervising and coordinating health, analyzing outcome, applying knowledge, applying principle of ethics, evaluating literature and study of forensic odontology and geriatric problems, computer proficiency and participation in professional bodies, implementing and monitoring infection control, and willingness and self-assessment to update knowledge and maintenance of record. They were all having a satisfactory level of competence achieved. The result regarding the assessment methodologies, the students perceived all the methods of assessment as adequate. They were neither poor nor excellent, but in the median range of adequate levels, which means this needs to be revised. Lastly, the main part, that was the evaluation of the hidden inclusions of ATCOM B competencies in the existing curriculum. ATCOM B is a very big document introduced by Medical Council of India in 2019. It has 24 attitude competencies, 7 ethics and principle competencies, and 3 communication skills competencies. We also included 5 bioethic competencies which are suggested by DMIMS. So mostly we found that all the students had low proficiency in 22 of the competency statements and moderate proficiency in 17 of the competency statements. I will be mentioning those ahead. So I will be mentioning only the ones which are having least or a low level of achievability. The first one, in attitude. In attitude, the identifying the conflict of interest in patient care, professional relationship, and describing correct response to the conflicts, as well as describing and discussing the role of dentist in healthcare system. So these parts are not well covered, whereas the others are well covered. There are 54 competency statements, which I cannot be covering every statement individually. So in attitude, mainly 2 things, that is conflict of interest and role of development dentist in healthcare system. Next, in ethics, there were most of the competencies which students perceived they were not able to achieve full competence was in ethics and ethical practices. They were mainly in the areas of parental rights. Some of them are not related to dentistry. That is why they are having low achievability. Similar like fertilization, donor insemination, and surrogate motherhood. Others are consent and research protocol writing, dentistry, industrial relationships, not to resuscitate or withdraw of life support, advanced directives and surrogate decision making, dealing with impaired dentist, abortion and medical termination of pregnancy and reproductive rights, emergency care, including situations where patients do not have capabilities of giving or capacity of giving consent, organ donation, right, equity, and justice to access healthcare, including healthcare in children, including parental rights to refuse treatment, research in human subjects and patient autonomy, patients' rights and shared responsibility in healthcare. The identification, discussion, and defending of medical, legal, and socio-cultural problems in all these mentioned subjects was poorly achieved by the dental undergraduates. These are adequately and well achieved. I will be not reading them. Last, in bioethics and communication skill. All the 5 competencies of bioethics are perceived as not being achieved properly. They were impairment in the sciences of genetic constitution and future generation in regards of medical profession, interconnection between human beings and other forms of life, traditional knowledge in regard to medical profession, role of human beings in protection of environment, biospheres, and biodiversities in regards of medical profession, interconnection between human beings and other forms of life. This might seem little vague, but these are the UNESCO recommendations which are actually supposed to be included in the ATCOM modules in coming future. In communication skill modules, the most low perceivability was achieved in communicating care options to patient and family with terminal illness in simulated environment. So, and the extended part of the result is a few open-ended questions like education to practice transition convenience. Only 18% felt that it is convenient to transit from education to practice without any additional training, whereas 54% found it to be challenging and 28% felt that it was impossible to transit to practice without additional training. The overall opinion regarding the curriculum showed that 45% of the participants felt that the curriculum is outdated. And suggestion regarding revision of curriculum focused on increasing clinical exposure and use of advanced technology and focusing on employability. So in conclusion, I would like to focus on summarize on 4 outcomes. First is participants perceived a need of revision of dental undergraduate curriculum with more emphasis on clinical research domains. The general skill, knowledge, and attitude competencies as mentioned in DCI curriculum and AdCombi competencies are included in the curriculum with low level of achievable competence. This needs to be addressed with a more structured module for conative domain competencies. These efforts will also be helpful to improve the confidence of students for a convenient transition from to clinical practice of dentistry. These are my references. I would like to end with this. Thank you.
Thank you so much, sir. I request Dr. Sudhakar, sir, for question and answer session. Please, sir.
Dr. Yatish Kumar, sir, indeed it's a good presentation regarding the competencies. I think, as you said, the last revision for UGs was on almost like 2007 or 9. I think PGs we had a revised curriculum from DCI, and we hope that
yes,
DCI is doing work on it. Recently, for
yes,
past
sir.
1 or 2 years, the Dental Council has made us to get accredited compulsorily with the NAC and other things, where NAC they have established an exclusive part regarding the dental health sciences. So as you told, the research competencies as well as the communicative skills are a little bit lagging. We are hoping in future that DCI, I think it under escalation in DCI, we are thinking and we'll get the thing in a better way, like the medical curriculum. Thank you, sir. It's a good presentation.
Yes. Thank you, sir. Thank you very much.
Thank you so much, sir.